Hi, everyone. I'm Amy Allen, Vice President with the Westchester County Association, and I want to thank you for joining us as we host another in our series of live video chats with subject matter experts who are sharing their knowledge and their expertise about matters relating to the current COVID-19 crisis. And before I introduce today's guests, I would just like to thank the WCA Platinum Partners, without whose support these programs would not be possible. Today's guest is Dr. Patricia Galiag, the Deputy Medical Director at WestMed Medical Group. Dr. Galiag oversees the clinical strategies at WestMed, including all of the surgical specialties and the Women's Health Department. And since she was appointed Deputy Medical Director, she has also managed the implementation of WestMed's Patient Experience Initiative. And most recently, with the current coronavirus pandemic, she has spearheaded the expansion of WestMed's telehealth program, expanding it across all their departments and specialties to well over 300 providers. So Dr. Galiag, welcome.
Thank you.
Now, before I start asking my questions to Dr. Galiag, I just want to let the viewers know if you do have a question, you can write it right on the bottom of your screen and we will get to it sometime during the show. Okay, so Dr. Galiag, tell us a little bit about telemedicine, or I believe you like to call it virtual visits, and why they are important and what kinds of occasions they are most suited for.
Sure, Amy, and thank you for having me. Well, telemedicine refers to sort of a broad topic of how you can connect with your physician outside of being inside the office. And telemedicine includes phone calls, email, texting. That's been around for a long time. What I think I'm going to speak today mostly is virtual visits. And virtual visits meaning the addition of a video conference tool to interact with your patients has also been around for some time, but not necessarily having been widely adopted by patients or providers. So in this current pandemic and COVID-19 situation, what we've seen across the country is certainly rapid adoption by both patients and providers for using COVID-19, using virtual visits for COVID-19 and other health matters. So at the start of when we recognized that we had a pandemic on our hands and the first cases began to arrive in the United States, we at WestMed certainly immediately ramped up our technology and our training of our entire staff of 500 providers, physicians and providers, and our clinical staff on how to use the various virtual visit applications that are available. And we made sure that all providers and physicians, advanced practice providers and physicians, were knowledgeable on the different ways to access patients.
Great. So what can you maybe expand a little more on how the use of telemedicine, really what the benefit is to the patient?
Sure. So virtual visits or telemedicine, right now, what's critical during this period of this COVID-19 pandemic is that you remain in contact with your providers, that you maintain your health care and truly stay in contact, be it for a COVID-19 related issue or any of your health concerns. What's interesting to know about telemedicine or virtual visits is that they're really effective for just about anything. And all physician and provider visits at this point should truly begin with a virtual visit. I can kind of go from head to toe in how virtual visits are helpful from the patient side. So at this time, the critical thing is to make sure we do not decrease access of patients to healthcare. We most certainly want to provide access to your physicians so that you avoid having to go to the hospital for a COVID-19 related issue or any other medical issue. And what's important is that we keep up with regular maintenance of healthcare so that your other issues that you would normally be going to the doctor for, your diabetes, your hypertension, your regular checkups, that you don't disengage from your healthcare providers. So if I think, I think providers and patients haven't really thought of how helpful virtual visits could be until this most recent pandemic, where we're really kind of revolutionizing the way we're doing a lot of medicine. I know at WestMed, when we were training our physicians and staff, and when we're reaching out to patients, we want to let them know that from head to toe, this is a good technology and tool for patients and physicians. From issues having to do with psychiatry or your psychological well-being. Right now, this is a difficult time for everyone. So having the availability of your healthcare providers to help you if you're confronting moments of depression or anxiety, and you're worried that if you already had depression or anxiety and it's worsening, your providers are there. Our psychiatrists, our psychologists, your internists, your obstetrician gynecologist are available, as well as all of your specialists. Even our ophthalmologists, while it is difficult to do a very complex eye exam, they're willing to interact with you virtually if you have more questions, and decide with you in a virtual visit if it's necessary to come in for an in-person visit. And what's great about having that virtual visit initially is that if you have to come into the office, no matter what specialty you're in, or you're needing care for, your visit in our physical spaces will be shorter because you've gone through a lot of the history with your provider. So we're doing pure virtual, a mix of virtual with an in-person visit. If you are a cardiologist, you can address some of your patients' concerns and how they're doing with their medication and whether they're tolerating medication. Everyone is available. We're open for anyone who needs to come in for what we consider an essential visit or an essential need. And that can be determined with an initial virtual visit with your provider. We have our GI specialist, that's gastrointestinal specialist, who will discuss your irritable bowel syndrome, go over your other issues, intestinal issues, your reflux. We don't want people's conditions to be ignored during this pandemic period. We have had patients with common conditions like diverticulitis be afraid to call the doctor and then end up in the hospital. This is the time that you don't want to end up in the hospital unless you have to. A virtual visit to start any evaluation of a complaint is a really good way to begin it. But, if you need to come in, offices are open. We are open. We are being safe. We are masked. We are temperature screening. We're absolutely, making sure that we separate anyone who might have COVID symptoms out at different times in different areas, so that we can protect and continue keeping this virus at bay as best we can. So I'm just thinking of other, so gynecology. I'm an obstetrician gynecologist in addition to being one of the medical directors. And your issues, even your annuals, if you were due for that, we really advise that you connect with your physician so that in an annual, I'll just give GYN as an example, a pap smear is part of it, and that's certainly not happening through a virtual visit. But there are many other issues that every physician goes through in those visits with a review of systems of how you're doing, and it is when we actually pick up other problems. So I think it's critical that if you have a physical coming up, that you contact your physician and, start with the virtual aspect, and then they can determine with you, what, you're looking good, we could put this off for 3 months. We're not sure when everything's going to open up, but at least you'll know. Your prescriptions can be renewed. We talked, seasonal allergies absolutely can be, addressed right now. Back pain, if you have back pain, our orthopedists are doing some of their visits with using virtual visit video conferencing. Our pain management, if you're having issues with that. Our dermatologists are certainly beginning their visits with a virtual component. And if it's necessary, they will bring you in if you really, really need to. but most of those visits can be accomplished through a video visit. We're really having, I think, great success. I know at WestMed, and I know across the country. I know initially we are one of the first organizations who put it into effect so quickly because we consulted with other organizations who requested help on which technology to use. And I would say currently greater than 50% of our visits are virtual. I think the issue that we're all facing is how long is this pandemic going to last, and how long are we going to have shelter-in-place orders? And again, it's certainly safe when you need to go to the physician to go in if you need to. And we're keeping you safe in every way we can. But we're still encouraging virtual visits as the first mode of interacting so that you can determine whether you need to be seen in person, and also can limit the time that you spend in any public spaces.
And yeah, that certainly is excellent advice. And I know, I'm sure many of your patients and patients in general haven't really had a lot of experience with telemedicine yet, although I'm sure they will. So a couple of questions from the patient's perspective. In terms of paying for these visits, through your insurance carrier primarily, has there been any change in how these are being paid for?
Sure. Well, interestingly, and people have probably seen it in the media, the term cost sharing, if you Google it, in response to coronavirus has really changed. I mean, typically with certain visits, you would have a copay, or you would have a bill that went towards your deductible. I think most carriers, as you can see in the news, are really trying to promote that patients stay in contact with their physicians, maintain health maintenance. And to that end, they have removed a lot of the cost sharing, meaning that for a visit that ordinarily might have had a charge towards your deductible, they are not charging the patient for that uncovered portion. So you can look it up on the internet with your carrier or call your carrier, but I would say most of the major carriers are really doing their part in helping in this pandemic and helping with social distancing, literally encouraging the use of televisits or virtual health over an in-person visit, which of course, we're there for you for that, but would like to keep everybody at a social distance when we can.
That's great. That's great to hear. And how about in terms of patients being able to adapt to using technology? I mean, do you find that in addition to being a medical provider, you have to also be an IT support provider, or do you have a separate department that handles that, or how's that working?
Well, it's probably a little bit of everything. I think at this time, I am so impressed by the physicians, but equally impressed by the patients, all of our patients' ability to adapt to different technologies. I had a 75-year-old patient the other day who, I think we had her on one technology which wasn't working, and in minutes I got on and sent her a Zoom invitation, and she did it in a second. I mean, and she's never signed into Zoom before. So we're pretty pleased with the ability of everyone to be able to connect. Now, in terms of help, yes, our nurses and physicians are well equipped to help for a portion of it. We also have, we're using Metasprout and Zoom as our major application. So with our Metasprout team, they are offering help directly to patients. Now, as time goes on, most of our clinical staff are more tech savvy, and so can help. We've learned simple things like make sure you're on your Wi-Fi when you do your virtual visit. Make sure you're in an area of your home that has good Wi-Fi. Make sure you have your volume on. Make sure you're not muted. If you can use, some people don't realize their computers don't have a camera, and it's using any smartphone. And currently, if you don't have the ability to download an app or you're confused by it, you can use, FaceTime. This is a period where we are using technologies like FaceTime and Skype and Zoom if you have to. We prefer the Zoom application that we're using and Metasprout that we're currently using are what are called HIPAA protected. So they are somewhat encrypted to protect you. These other applications are not now. There are laws that govern using HIPAA protected applications, which have been relaxed during this COVID-19 pandemic. We at WestMed continue to promote the use of a safe HIPAA protected application. And I would say for at least 90% of our connections, they're working just fine. Long term, when we continue probably to do telehealth, because a lot of patients really like it, we will move to the HIPAA protected applications. That the recent changes are related to the pandemic.
Makes sense. So it sounds like for 99% of the time, a virtual visit should be the first contact, especially currently, that a patient might have. Is there any situation where it's not appropriate that a patient should immediately go to their provider or to the hospital? If you can answer, let us know about that.
Sure. Well, I think almost everything, our contact center right now is booking these virtual visits right into provider schedules. We currently have online booking for virtual visits to most of our providers. If you're having respiratory symptoms, a phone call absolutely to your provider, but obviously, not obviously, if you are being monitored for COVID-19 and you've either been tested positive or you're under suspicion for having it, should you develop, respiratory symptoms or shortness of breath, you are going to need immediate care. And if our urgent cares are open, but a call to your physician always helps so they can tell you, even over the phone, whether you need to, if it's a dire situation, you're going to, possibly be triaged to go right to the hospital. So, clearly anyone with, severe COVID-19 symptoms, we're going to want you to get an in-person visit. We just would have to decide where that should be. If you break a bone, hopefully you won't. That is not something we can typically fix virtually. So I would still contact the providers. If it's a little digit on your toe, sometimes you can actually tape it. There are little things. It's interesting. We've all become very creative, even with assessing milder symptoms of COVID-19 and being able to assess your respiratory rate. Physicians are teaching patients, how to take their pulse, asking. I've had patients be so ready for their visit when they get on. They've already taken their temperature, weighed themselves. If they have a home blood pressure cuff, they've taken their blood pressure, and they're just ready to go with information.
Yeah, well, it's going to be, as we all kind of head towards the quote-unquote new normal, it's probably quite likely that patients will perhaps continue these virtual visits, even when they don't necessarily have to stay away.
Right. I think we all will miss the human interaction of a person-to-person live, next to each other visit. And I think for many, we will go back to that. And certainly there are aspects of a physical exam that we can delay for a while, but we'll need to, with our annual wellness exams, resume at a time that is safe. I think for many people, this may be a technology they use for some of the medication management, for hormone replacement. There are certainly areas where maybe this will be the favored mechanism. I think we'll have to see. Certainly for the busy person commuting, working, rather than missing your visits, I would like you to use your telehealth even in the future in your virtual health. Personally, I miss seeing patients, so I'm hoping they come back to the offices when the time's right. I think there's, it's an important interaction that we have in our lives.
And I'm sure the feeling is mutual. Yes, I would think that patients are looking forward to the day that they can actually go back and see face-to-face with their provider. So this has been really helpful, and it certainly sheds a light on just how robust a use telemedicine and virtual visits have for all of us. So, in the few minutes that we have remaining, I don't know, is there anything that we didn't get a chance to talk about? Any words of advice you have
Well,
for our
sure.
viewers?
I think the slide that was put up before in terms of, a few of the things that you might not think of about what's great about virtual visits. It is, convenient and safe and covered by your carriers, but it's also, safe to keep you out of emergency rooms right now. So that's a critical thing. I think, one of the other points is that we're maintaining using this, we're helping flatten the curve together. And then, you're still not interrupting your care, which I think is very important. And other benefits are, sorry, I'm just reading what slides you're all seeing out there. I just think, in addition, one of the points that we had raised earlier today was how our personal protective equipment is certainly preserved when you do a virtual visit, as it just reduces the amount that has to be used in the clinical spaces. I mean, all in all, I think it's an excellent adjunct during a time when we're dealing with a really unusual situation. I think key points to remember are we're here for you. We're both in person if it's necessary. Your care is there. What we are unfortunately seeing is patients are avoiding not only going into the doctor, but even calling. And extra operations are happening because certain chronic conditions are being ignored, from issues with diverticulitis or something that maybe your gallbladder might have been managed with antibiotics, but because there's a fear, which we all understand, people are not getting some of the care that they could have to avoid your illness progressing. So whether it's COVID or another problem that you're having, please reach out to your physicians. We are all here. We are all working and, available.
Yeah, well, that's great to hear, and we certainly applaud WestMed for their leadership in this, and a huge debt of thanks to all the medical providers and the hospital workers, everybody on the front line who are working so hard to keep everybody healthy and safe. And again, I want to thank
I was just going to say, I would want to thank our patients. I have to say, it's been an impressive time. Many, many patients have reached out to us individually, to the hospitals. The donations have been, from food to, giving up masks that they may have bought early on. I think it's been a tremendous effort of everyone working together to try to control this and be cooperative with each other.
Yeah, that's great. It's great to see the community step up. So I understand we do have one question from the audience. I believe it will be put up on screen now. Do you think telehealth will change the way insurance carriers approach the marketplace? I'm not sure
Well,
I know exactly what that means.
Well, I think I think it'll be hard for them to go back on some of it. I think they've really changed in terms of their coverage for many diagnoses, which is interesting. And what will happen is when you see consumers or patients, however you want to refer to people purchasing the insurance, I think it's going to be a stipulation. I can't imagine that when businesses who are actually often the person who is purchasing the insurance for their staff, they're going to want people to be able to address a problem virtually. If it's something that they can do in 15 minutes and not come out of the office and go up to a doctor's office, I think it certainly increases productivity all around. Again, I don't want as a physician to lose the ability to have the in-person interaction, but I would certainly like to be able to improve access to healthcare and follow-up of healthcare. I mean, I know myself, do I address every issue? I'm busy, 24/7. I think there's many adults out there, even teens, who are so busy with what they're doing that they miss follow-up. So I think it's going to be a critical part of improving access And I think that insurance carriers will have to recognize that. And I think they have.
Yeah. Well, keeping it a holistic process is going to be important. So we have another question. How is the PPE situation holding up?
It's okay. We seem to be very fortunate, both WestMed and our local hospitals of White Plains and the Greenwich Hospital. I think that for WestMed, we immediately responded by, I know it could have been inconvenient for many patients, and I'm sorry about that, but we immediately responded by probably before anybody stopping all in-person non-essential visits, because we recognized as soon as the cases happened in our local area of New Rochelle, where we have several large polyclinics in New Rochelle, Rye, and White Plains Purchase. We knew right away something was going to be happening, and we had to be careful and make sure that we could stay open with the personal protective volume of equipment that we had at that time for an extended period. So we were pretty careful immediately. I think that more resources are coming into the country now, and that should help. We're waiting on a shipment, so if anybody has any extra, we'll take it still. I mean, we're doing well. We're able to keep the doors open, and that's been the challenge of balancing. Do we stay open for everything? Do we limit the buildings? All of our buildings are currently open except our New Rochelle site right now. And part of when we had to move to closed buildings was because we needed to reduce staffing in the different buildings to make sure we had enough protection for all of the staff and providers, and even patients when we have to. We are actually in a good place right now, but always accepting donations.
Good to hear. One other question. What is your thoughts about CMS keeping telehealth at the level it is now as it relates to encouraging providers to use it as a staple tool post-COVID?
I think that CMS I would imagine they would absolutely want us to use it. I think they wanted us to use it before. I think they had to adjust their model a little bit and make it easier for both patients and providers in terms of, what's getting covered, what's not getting covered. It's a critical thing for CMS. I mean, there are patients who can access care regularly and end up having worsening of their chronic conditions. So absolutely, even I know that we were already moving towards a remote monitoring program for blood pressure to be, one of the technologically advanced outpatient centers that would do close monitoring of your blood pressure from home. We were already investigating programs done at the Brigham at Harvard up in Boston to implement that program locally, and it'll be great now because everybody will be ready. For some areas, obstetrics, we do have the ability to do some of our monitoring outpatient. We have arranged for patients to be able to get Dopplers. That's on the outside of what makes us feel comfortable. Dopplers are what listens to the baby's heartbeat. It's certainly something we're doing in this crisis situation, not something I would favor for the most part for certain areas, where there's just a little bit more risk than we feel comfortable doing outside of this. But I think CMS will probably have to maintain some of that. At least I hope they do.
Yeah, it sounds that way, and I think in conjunction with what the insurance carriers and how they're treating it, it seems likely it will be continued to be used.
We have a shortage of
sorry.
primary care physicians across our country, and we have a shortage of primary care physicians here. So it's going to help improve access. Just being able to allow physicians to extend hours and do a couple of visits later in the day. I mean, it's a critical need. I think that everyone, now that they're used to the technology, it will have to be part of the marketplace.
For sure. Again, well, thank you so much, Dr. Kaliak. This was very, very enlightening. I think it'll help people feel more comfortable about using telemedicine, virtual visits. Again, I want to thank our WCA Platinum partners for their support. Obviously, we appreciate that. Also, want to encourage everyone to join our Facebook group and our LinkedIn groups. We can share resources with each other, as well as looking for information on the WCA website. So, Dr. Kaliak, thank you again. I know you're very busy and really appreciate you taking the time with us.
No problem. Thank you for having me.
You're welcome. Okay, thank you, everyone.